There's been a dramatic increase in the spread of swine flu in Australia, forcing the federal government to raise the alert level. The first 2 cases of human-to-human transmission have been reported, taking the total to 11. 7 are in Melbourne, 1 in Sydney and another just north of the city, 1 also in Brisbane and the same in Adelaide.
In the latest 2 cases, 1 in Victoria and 1 in South Australia, there were no recent overseas travel, and it's not known who those people came into contact with to pick up the virus. 3 schools have been closed, 1 in Victoria and 2 in South Australia. In a day of rapidly moving events, the Health Minister, Nicola Roxon, called 2 separate news conferences to keep the nation informed. She warned the number of cases could rise on an hourly basis.
It is important to emphasise that all of the confirmed cases we have to date have been experiencing fairly mild symptoms, and we do encourage the public to remember that there is no cause for alarm.
In the latest cases, a 15-year-old girl became South Australia's first confirmed case of swine flu. Students arriving at this Adelaide school were turned away as the school closed to prevent the spread of the virus.
They just told us not to worry too much about this. I think it's fine. Yeah, it's fine, yeah.
In Melbourne, a 17-year-old boy from the northern suburbs is Victoria's latest victim. He, like the South Australian girl, has no history of overseas travel. And a 10-year-old girl has been quarantined. She's a classmate of a boy at the Clifton Hill Primary School in inner Melbourne who contracted the disease after returning from California. The school has since been closed and students in classes affected by the virus told to stay home, among them 8-year-old Rafi Scott. Despite the spread of the virus among students from the school, parents say they're not panicked.
They start by being panicked, but as they get the information, I think the health department have been there at every turn, the school's been great.
The change in alert level means the government can put in place additional measures, such as moving the Tamiflu stockpile to particular states if need be. Australia's Chief Medical Officer says the government would continue to monitor schools.
So you'll see more activities around schools because the evidence is there's a lot of mixing of children. They mix extremely socially, and we know that is an important issue for spread of this particular virus.
There are now 41 countries throughout the world with swine flu and more than 11,000 cases around the globe. Melinda Ogden, World News Australia.